Hello, Dr. Dennis Lee here. Today I'd like to talk to you about Moxibustion. So the theory of Moxibustion therapy is an ancient form of healing which is part of the traditional Chinese medicine system, which dates back over 2,500 years.
Moxibustion therapy involves the burning of the plant mugwort, or aicao in Chinese, on or near the surface of the skin. Moxibustion has been used to treat and prevent disease for over 2,500 years in ancient China. The therapy is an integral component of TCM and is in modern times considered part of the scope of acupuncture, as it is applied to the meridian systems of the body. Moxa has three main methods for administration. The first is called direct moxibustion. This involves rolling loose moxa leaves that are dried into cones or using rice grain moxa, and these cones are placed directly on the skin. When lit, the moxa will burn and combust, and you'll get a warming effect on the skin. Now, there are two types of direct moxa in reality, a scarring and non-scarring. In North America, especially in Canada, we do this non-scarring method to protect the patient. Another type of moxibustion we have is called warming needle. Now, this is a very interesting method which involves the placement of a moxa cone on an acupuncture needle which has previously been inserted into the body. When lit, this provides warmth and stimulation to the acupuncture point through the needle. It is very commonly used for pain syndromes, paralysis, and atrophy. Indirect moxa has many different types as well. And so this is where we may place a moxa cone on the skin, but having an insulator or a medium in between. Now, some of the more common mediums include ginger, garlic, or the Chinese preparation of fuzi, or monk's hood cake. Something that's very popular called suspended moxibustion. And suspended moxibustion involves holding a moxa stick over the skin, however, never touching the skin directly. And so what does moxibustion actually do? Well, in modern research, it's been found that there's a thermal effect which provides heat. However, more interestingly, there's also a very, very powerful infrared effect. And this infrared can stimulate blood vessels, dilation, constriction, and also help with cellular metabolism. There's a third type of effect for moxa, and that's actually the Moxa Smoke itself, which is being found to be quite antimicrobial, especially antifungal. And so you'd use it like a fumigation where you'd light a moxa stick and put the area that has the disease or the problem over the smoke. And so why use the herb mugwort or aicao? It's very, very interesting because this herb in ancient times was deemed the one for moxa because it has thermal properties itself. It is a very, very powerful herb for stimulating qi or yang in the system, and it's able to circulate qi through the 12 channels, we say.
So what are some of the main functions of Moxibustion? In practice, Moxibustion is often used for pain-related issues. Now, this may range from chronic pain to acute injury, soft tissue, bone, muscle, and joint. Another major application are systemic problems such as cardiovascular health, respiratory issues, metabolic problems, and digestion. Another big part of Moxibustion is its ability to treat overall health concerns as far as aging, people who are subject to chemotherapy, people who have been going through other chronic diseases. And finally, one of the main applications for Moxibustion revolves around its ability to prevent, not only to treat, but actually to prevent disease and to maintain a healthy lifestyle. In Chinese medicine, we think Moxibustion will tonify qi or yang, we say. It's also very powerful for draining damp and scattering cold. And the reason is it's able to travel to all the 12 channels of the meridian systems. So Moxibustion is a great alternative for people who, let's say, don't like needles or are afraid of acupuncture. It's also very good in children and in elderly people where acupuncture may be too stimulating for them. Now, Moxibustion can be used on its own or in conjunction with other treatment modalities. Overall, it does not have any side effects and can be safely applied to anybody in the population. Thank you for watching.